high cholesterol is a concern because it's one of the major risk factors for cardiovascular disease, and it's something that we can control. It's important to understand how high cholesterol affects your body because you can change your cholesterol levels in many different ways. There's a lot of interventions you can do to help with lowering your cholesterol, and they're not always medications. So you can't feel your cholesterol level. There's no way to know what your cholesterol is just by feeling your body or even necessarily by symptoms. High cholesterol is asymptomatic. So the only way to know is to do a blood test to check. The reason why we like to screen cholesterol is because early screening and early detection of high cholesterol leads to early intervention. And if we can lower people's cholesterol and intervene early, we can prevent the formation of atherosclerotic heart disease. And in doing that, we can prevent future heart attack, future stroke, and other kinds of cardiovascular diseases. Getting your cholesterol tested is actually very easy. We recommend that you test your cholesterol every 4 to 6 years, starting at age 20, and it's a simple blood test. But if you're someone who's at risk for heart disease, it's important to be aware that you may want to be more proactive about getting your cholesterol checked. So for instance, if you don't exercise or are overweight or smoke cigarettes or have diabetes or have high blood pressure, these are all very significant risk factors for cardiovascular disease. If you layer on top of that high cholesterol, your risk just increases more. So it's really important to try to intervene on cholesterol early, because if you treat your cholesterol, we know that we can lower it and we can lower your risk of having a heart attack. There's a lot of genetic causes for high cholesterol. And so it's really crucial, to check your cholesterol, to know, even if you feel like you're a fit person. I've had many patients, I can think of a marathon runner who's done multiple marathons but has an LDL cholesterol that's very, very high. And that puts that patient at risk. And so despite the fact that this person runs and is highly fit and athletic, they take a statin because they want to lower their cholesterol.